So for the oral cavity, there's going to be a little piece of mucosa that's under the tongue, and that'll be the lingual frenulum. It's probably better to look at the picture for that. And then in the oral cavity, you have the hard palate, the soft palate. Through this hole in the soft palate is the nasopharynx. The incisive ducts are behind the incisor teeth. They're hard to see here. These folds in the hard palate are called rugae. Whenever you look on the tongue, the little papillae that have the spines are the foliate papillae, and the fungiform ones are dispersed amongst them. Sorry, filiform for the spines, and then fungiform around that. The foliate ones are the ones that are on the corner here. And then the valate papillae, they form a V on the back, and they're harder to see, but just know valate starts with a V. The median lingual sulcus is just the line that's down the middle of the tongue, and then this whole side of the tongue is the dorsal side, but it's called the lingual dorsum, this entire part of the tongue. And then whenever the tongue is still intact, it's hard to see down here, but there's arches that are formed on the inside walls here, and then those are the palatoglossal arches on the sides, and then the space between them is the isthmus faucium between them. And then the oral vestibule is the space in between the cheeks and the teeth that is there. And then whenever you take out the tongue, the oropharynx is just the region that's between the palatoglossal arches that you saw earlier. The palatine tonsils, they sit in the little corner there. Can't see it as good on that side. Here, you can see it in the corner. Mine are actually, here it is, yeah. Here, the palatine tonsil, and it sits in the tonsillar fossa. And then for the laryngopharynx, it is just the region where the vocal cords are in the larynx, the voice box. And this little triangular flap is the epiglottis. The space is the glottis. And then the esophagus, mine's been cut away, but if you stick the probe right here, this part has been cut, but that goes to the esophagus. When you stick the probe through here, it goes to the trachea. These little cartilages right here, they're hard, are the arytenoid cartilages. The tiny part of the mucosa here are the false vocal cords. The true vocal cords, or the vocal cords, are the white parts of the mucosa here, and they're the ones that are mainly used to produce the sound. And then from here you can also see the thyroid here. It's not on my other side. This is the trachea with the tracheal rings. Here I've scraped away part of the muscle, but you can see that there's a cartilage right here, and that's called the cricoid cartilage. The cartilage that is after the muscles here, that is darker in color, is the thyroid cartilage. The muscle between is the cricothyroid. You don't need to know it, but do know that that's a landmark you can use to identify the two cartilages. And then we go into the pleural cavity. So I'll do this side first. Whenever you're looking on the right side, you'll have the different lobes. So you'll have the cranial lobe, the middle lobe, and then the caudal lobe, and then the accessory. And then the accessory lobe sits into the cable fold. Here you can also see the caudal vena cava. It's injected with blue. Yeah. But you'll see it injected with blue ink. And then you'll see a nerve that runs over it, parallel with it, that goes to the diaphragm, which is here. And that nerve is the phrenic nerve. And then on the left side, you have the lobes. And again, it's just caudal, middle, and then, cranial, cranial, middle, then caudal. And that's of the left. And then here you can see the heart. The heart sat between the layers of the parietal pleura, and this layer that you can see here now, this is the parietal pericardium, the visceral pericardium's on the heart. The thymus, you can see it's just this darker organ right above the heart. And then for that part, and the pulmonary ligament, that just is what anchors you can't see it, it's deep in there, but it anchors the lobes of the lung to the little wall, the medial wall. And then the principal bronchus and the root of the lung, those are more definitional. And the aorta will cover on the cardiovascular system. And then whenever you look really deep in here, you can see the esophagus right here. So this is the esophagus, and this is the aorta. So esophagus, and then the aorta is next to the vertebral column. And then whenever you move past the diaphragm into the peritoneal,